Australia's first case of coronavirus has been confirmed in Victoria as New South Wales announces it has 2 probable cases. The federal government is advising all Australians not to travel to the Chinese province of Hubei.
The deadly coronavirus has reached our shore.
We now have a confirmed case of the 2019 novel coronavirus in Victoria, the first case in Australia.
A Chinese national in his 50s flew from Guangzhou to Melbourne on January 19. He'd spent time in the city of Wuhan, where the outbreak originated. He's in isolation, being treated in Melbourne's Monash Medical Centre. Victorian authorities have confirmed all passengers on the man's flight will be notified.
Obviously, we'll be working closely with the airline involved and Commonwealth officials to secure the contact details for those passengers. Those passengers will be contacted and encouraged to seek medical advice if they have any concerns.
Several people are waiting on test results.
In terms of the New South Wales situation, we have currently got 6 cases under investigation, and we have 2 of those cases on preliminary testing indicate they are probable cases.
I wouldn't be surprised if we had further confirmed cases.
The Prime Minister is advising Australians to remain calm.
The preparedness and the plans and the capabilities are in place here in Australia to deal with issues of this nature.
Australia has raised the travel advice for Hubei province to level 4. It means do not travel there, or you may not be able to leave until restrictions are lifted. Gabriella Power, Sky News.
Meanwhile, in China, the death toll has risen to 41 and more than 1,200 people are infected by the coronavirus. The country has expanded an unprecedented lockdown to 13 cities now, at least 36 million people, to try and prevent its spread.
This is the front line of the epidemic in Wuhan, and it is bleak. We cannot verify the status of the people under the sheets. It is a crowded, chaotic and terrifying scene. One that shows what doctors, nurses and patients are enduring together. The footage is at odds with the efforts on the ground portrayed by state media. This is the extraordinary sight of a new 1,000-bed hospital being built from scratch in less than a week. The infrastructure propaganda that is a symbol of China's rise, repurposed for an epidemic. State media also focused on the bravery and hard work of medical staff in Wuhan, albeit in more sanitized conditions.
What worries us most is the inconvenience caused to local residents. Although we have taken some countermeasures to alleviate the situation, there are still many difficulties. We aim to use the temporary inconvenience in exchange for long-standing safety.
Wuhan itself has been cut off for more than 36 hours now. People are stocking up on supplies because they simply do not know how long they'll be on their own. In Xianing, south of Wuhan, authorities turned toll booths into checkpoints. They measured people's body temperatures. Anyone with a high reading was sent to hospital. In the capital, Beijing, the televised celebrations for Lunar New Year are choreographed months in advance. This was an uncharacteristic last-minute addition, a tribute to doctors and a rallying cry for the country. It must have felt a world away in Wuhan.